firefighters here. The only time that you'll be a firefighter, and we're going to practice that today, you probably remember that from last year, is if the fire is in or on the patient. We can't wheel the patient on fire out into the hallway and then close the door and then expect like, not my problem anymore, right? So at some point you will have to deal with that in that environment, in the OR, in the surgical environment. And so what types of protection features do we have around here? When the alarm activates, what closes? Okay, so if the fire doors, we call them fire doors, but essentially really what we're trying to capture is the stuff that kills most people in fires, the smoke, right? So we'll talk about that later on, what that means for all of you guys. But, really what we don't want you to do is we don't want you to stand there with the door open. That's one of the biggest things. We got to get doors closed around here quick. So what else do we have? When the fire alarm activates, the ventilation system shuts down everywhere here, even in your environment, okay? What else? Sprinklers, okay? We'll actually flood the building faster than any fire will ever burn it down. It's 25 gallons a minute of water at a very high pressure, okay? So, that's a lot of water. We'll talk about that here during the program. What else? Fire extinguisher, right? Like, I'm okay with, if you're confident, if you're comfortable with using a fire extinguisher, have at it, okay? It's game on. But if you're not comfortable, if you're not really confident with using a fire extinguisher, could we inadvertently hurt somebody or kill them? Yeah, right? And so today we're actually gonna get a chance to practice. For those of you that want to do that, because I can show you how to, on the screen, and be like, oh yeah, pass, pull, aim, squeeze, sweep, all that stuff. But like for me, I'm a tactile person. I need to feel it, I need to touch it. It's a good review for not only for putting out a fire here, but also at home as well. Okay, and I've had staff members say, hey, you know what, that time that I went through fire training, I had a fire at home and I was confident with being able to put out that fire at home. Okay with that? Any questions? Okay, so we'll move things right along. All right, a lot of information here in a short amount of time. We are going to talk just a little bit about the ingredients of a fire, okay? And so the best way to not have a fire is to know how to prevent it, okay? Now, we're also going to talk about you could do everything right, okay? Everything. You had a fire not that long ago, like 5 years ago-ish time frame, not here, right, but within the Methodist system. And, I'm talking with the staff members, and so, if it can happen to the one surgeon that is like, the surgeon that is on like all the time, we do our timeout, they wait, they identify a bunch of things. If it can happen to that individual, it can happen to anybody. Okay, and so how do we deal with that? And then towards the end of the program, again, we're going to light a fire. You guys are going to get a chance to practice putting that out, and then with the fire extinguishers as well. Okay. Now, even before we start the case, we got to do our timeout. So who's responsible to do the timeout? Typically the circulator is documenting those things, but in the room, who's responsible to do the timeout?
Everyone.
Everyone. Because if you have a fire, who are they going to ask? Right? Everybody that's in the room. Did you do your timeout? Did you wait? Did you talk about prep solutions? Did you talk about fuel? Did you talk about ignition sources in the room? Yes, we did. No, we didn't. Those types of things are what they're going to ask you in the event of a fire. So it is a team effort, right? I understand that there's a hierarchy in the room. I get that. But I'm just here to say, if we don't do something, patient's going to die, right? And so we have to do something in order to keep that patient alive, okay? Now with that comes ingredients. So what do we have for ingredients of a fire? We have oxygen, and we're going to talk about that in just a second. We have our fuel sources, so keep that in mind. And then as soon as we introduce fuel, right? Like, what is fuel in that environment? Anything is fuel. If we heat it up to a certain temperature, it'll burn. Okay. So oxygen is an oxidizer. Within itself, I can open up an e-cylinder right now, spray it all over the room. Nothing's going to happen. Why? Do I have a campfire next to me? No, I don't have a heat source in the room, right? That is like an open flame. Okay, now again, there's a lot of things that we can do to prevent that from happening. Now, it does take something that doesn't readily burn, right, those fuel sources, and it makes it burn at a very hot and fast rate. So what does that tell us as staff members? There's a fire in the room. Can we be lazy here? Can we negotiate things? This isn't up for negotiation. Circulators, at times you're the loudest voice in the room. Direct and specific instructions here and what needs to happen, okay? I already see like some heads like, right, like direct and specific and loud. Now with that, is I just have a really short video. The guy that's presenting in the video, they do talk about, it's like maybe 100% oxygen really isn't necessary. Open delivery, right? So ET tube, I'm not really as concerned about that open delivery, but as circulators, as scrub techs, these are some of the things that we're looking for. Tenting, it's heavier than air, so it's gonna pool in places in and around the patient, underneath the table, especially if we're tenting, right? So we've just got to make sure that we're either slowing it down or we're dissipating that using room air. There's a bunch of different options. At least we need to identify that. I don't really know, something like, is 100% oxygen necessary? That's for the anesthesia provider. That's for the surgeon to talk about. I don't really know if we have any input in that, but hey, you never know. We have to have those discussions, okay? Watch what happens here. Maybe.
Hazard has to stop. We know how to prevent it. We know what causes it.
Mark Bruley, who has been studying surgical fires for more than 40 years, says most of these fires are sparked when oxygen pumped to the patient meets an ignition source, like a laser, and some kind of fuel, like fabric. But he points to a problem, saying some patients don't even need this added oxygen, and those who do are often pumped with higher concentrations than necessary.
Again, I don't really know if that's for us to debate. That's more so for the surgeon and the anesthesia provider in the room. Here's what happens when they introduce that heat source with the oxygen. Again, doesn't really burn readily, but when we introduce that heat source, that's when we have a problem.
Bruley uses a material that acts like human skin over the surgical area. Oxygen flows to the mannequin through a non-flammable tube, and once the oxygen builds up,
Are we ready?
watch what happens when the medical tool hits the skin.
Whoa. Oxygen off, please. And what we have is damage to the patient's skin. The fire also burned underneath and scorched other areas along the upper chest.
Wow.
And depending on the amount of oxygen, you could also wind up with burns to the cheek, the eyes, the chin, the nose.
I'm not trying to scare you, but I am trying to scare you. Like, these events do happen. Nobody's immune from this, right? And so when we talk about when there's a fire that happens, a very small, right, like something from a Bovie, if we don't cut the oxygen off, right, we could do everything. We could use a fire extinguisher. We could, use the clothing, like the surgical towel where we're putting out the fire. It won't go out. Right? We have to get that oxygen cut off as quickly as we can. Okay. Now with this, there are some options, like with anesthesia providers, there are things like fire-resistant ET tubes. They can inflate the balloon with saline. They do have some options if it truly is a high-risk case. And that usually is xiphoid process and up, open delivery of oxygen, or something like thyroids where they're very close to the airway. Things like that is really what we need to focus in on. Now with this, when we talk about the oxygen, it's not running out into the hallway to try to find the valves, to turn off the valves in the hallway. Because if you put the fire out, right, it's okay to stay. Like, we put the fire out, it may be safer for you to stay in the room than try to evacuate your patient now out in the hallway where you're trying to complete the surgery, or at least to the evacuation site. So we're not gonna necessarily worry about the valves. Eventually, if we do abandon ship, if it's no longer safe in the room, yeah, we can cut the valves in the hallway, and that's perfectly acceptable. But up until that point, hi, good morning. Now I got to start all over again. I'm only kidding.